One.
Okay, so Senate Government Operations, it is Tuesday, April 27th. Ooh, yikes. And we are going to start today by looking at the OPR bill. It is H289 for those of you who want to watch or follow it. And I believe the only thing we have left to discuss on this, Lauren, help me if I'm wrong here, and Ameren, is the issue of the naturopaths and death certificates. Everything else we have, I believe, decided. Ameren?
For the record, Ameren Abergele Legislative Council. I don't believe the committee has taken a look at the most recent language, which would add in the that small phrase that was requested by Jill Olson. And then also at the end, there is that language around, gosh, now I'm blanking on it. It's the very last section that would add into the unprofessional conduct section of Title III, language around convictions of crimes and sort of steps and factors that would need to be considered in whether the board or a hearing officer determines whether to deny or discipline a license, certification, or registration.
Oh, yeah, okay.
So those are two things that are in this draft that the committee has not gotten a chance to see the language, and I don't know. It looks like Director Hibbert also has something to add to that.
Okay, Lauren, did you?
Yes, for the record, Lauren Hibbert, Director of the Office of Professional Regulation. I just wanted to add that I don't think the committee has voted on effective dates yet either. I think that whole last most recent amendment that Ameren and I were working on hasn't had any official action by the committee.
On effective dates?
On effective dates, yes.
Okay. All right. Well, I think that we point out that Jill, oh, wait, no, let's go. I think Sam Russo has you have some time constraints. Is that right?
Yeah, I'm between patients right now. So
okay, so why don't we go to you first?
Great.
And this is the issue of whether NDs have had the proper training in order to determine cause of death.
Great. Thank you for the opportunity to testify. And I did send a memo with my testimony to share. I'm Dr. Sam Russo. I'm a naturopathic physician and licensed acupuncturist. I'm the chair of the Legislative Committee for the Vermont Association of Naturopathic Physicians and a former advisor to the Office of Professional Regulation. I'm currently a primary care provider. I work at the Community Health Centers of Burlington and their Winooski Family Health Office. And so I'm following up on some questions that came up from the last testimony. And I'd like to start with just the Vermont statutory definitions on healthcare professional, because there were some questions around that. We did some research to find out why NDs weren't included in the definition of healthcare professional under the vital records statutes. And the common denominator between medical doctors, PAs, and APRNs, specifically nurse practitioners, is that they're all considered primary care providers. And naturopathic physicians are also considered primary care providers. Osteopathic physicians are included in Title 18, not included in Title 18, but they are in Title 26, so they have language specific for their authority in their statute. So at the last hearing, there was questions raised as to whether this definition of healthcare professional was created prior to or after our licensing law. And we have a timeline of the definition that we've provided. And in 2009, the definition of healthcare provider for the purposes of death certificates was enacted in Title 18, Section 5202A, where a licensed healthcare professional means physician, physician assistants, or advanced practice registered nurse. In 2012, NDs were not yet considered primary care providers, back in 2009, but were added as a primary care provider under Title 8, Section 4088, where health insurance plans shall ... recognize naturopathic physicians who practice primary care to be primary care physicians. In 2017, Title 18 was then also amended in Section 4999 and an act relating to vital records, where for the purposes of vital records, generally the definition of healthcare professional was defined as MD, PA, APRN, and was simply moved from Section 5202 and put in as a definition in 4999. So even though Section 4999 passed after we became primary care providers, the definition was created prior to becoming primary care providers, if you can follow that. So what we did is we reviewed the testimony from Act 46 that was presented in 2017 when some of these changes took place in both the House and Senate Government Operations Committee, and found no reference to this issue. There was no reference by the VMS or any other witnesses. And the Vermont Association of Naturopathic Physicians didn't testify either. There had been no issue at that time regarding our ability to sign death certificates. So it wasn't until this situation that came up recently that we became aware that the Department of Health had taken the position that NDs were not permitted to sign death certificates. So I think it's more of a situation of kind of a regulatory oversight. So we also took a look at other states' laws. There are other states that have been licensing NDs for a significantly longer period of time. So states that do allow NDs to sign vital records, including death certificates, include Arizona, California, Hawaii, Maine, New Hampshire, Oregon, and Washington. And then to answer some of the questions around trainings, generally any healthcare provider who's trained to diagnose and treat illness, especially providers considered a primary care providers, are competent to be licensed to have the ability to clinically diagnose birth and death. These are results of healthcare. Death is a result of a healthcare problem. So if you can't diagnose a condition, then you shouldn't be practicing. So when looking at education, regardless of provider type, whether you're an MD or an osteopath or a naturopathic doctor, there's a wide variation in the provision of training of end-of-life care. So currently looking at the Liaison Committee on Medical Education, this is the organization that accredits allopathic medical schools. Their requirement is the faculty of a medical school ensures that the medical curriculum includes content and clinical experiences related to each organ system, each phase of the human life cycle, continuity of care, preventive and acute, chronic rehabilitative, and end-of-life care, period, without further description of what end-of-life care is. Now, the analogous organization is the Council on Naturopathic Medical Education, also recognized by the U.S. Department of Education. And this is the organization that accredits naturopathic medical schools. They require didactic and clinical coursework in geriatrics in all naturopathic programs, and requires naturopathic programs to provide training on support for patients related to acute and chronic illnesses and end-of-life issues. So it is required through our accreditation process. So specifically regarding the education on completion of a death certificate, there is no standardization in education across different professions. Many programs have relied on the CDC as well as the state's departments of health to supply supplemental education on completing such documents. This also includes the Vermont Department of Health, which provides a training section of materials for physicians, PAs, and APRNs. I did speak with some medical doctor colleagues at UVM who do supervise residents, and it's really an on-the-job, training experience. But back to the naturopathic physicians, to further develop the skills necessary for end-of-life care, naturopathic programs have also placed emphasis on practice in the field. To that end, most naturopathic programs have created rotations within hospices, nursing homes, and assisted living facilities to give patients and residents an opportunity to practice these skills. In Vermont, naturopathic physicians guide patients in completion of advanced directives and end-of-life planning, including preparation of do not resuscitate orders. Now, NDs, like other primary care providers in Vermont, should have the authority to sign birth and death certificates because we've demonstrated we have the training and competency to do so. Not allowing NDs to do creates additional barriers for patients who rely on NDs for their primary care. This creates undue stress and hardship for families at a time when they're vulnerable. Such a result is not theoretical, it's actually happened. We've resulted in harm to a patient's family due to the delay with funeral arrangements, estate proceedings, and other legal and personal matters because a death certificate was denied as signed by an ND. So as such, we have proposed these three amendments, one to Title 26, Section 4124, one to Title 18, Section 5071, which is in regards to birth certificates, and then Title 18, 4999, which would include naturopathic physicians as a provider who could sign a death certificate.
Thank you. Committee, any questions? Okay, Senator Ram, did you?
Oh, I was just saying that was extremely helpful.
Yeah, it was. So Lauren, any comments?
Yes, hi. For the record, again, Lauren Hibbert, Director of the Office of Professional Regulation. I didn't see a copy of this testimony before joining the Zoom, so I'm really not prepared to speak to Dr. Russo's points because I didn't fully understand the ask. But the modifications and expansions of healthcare provider, I think, should be done carefully. I fully support the request that was made previously in this committee to look through the statutes to find out when physician was used, when healthcare provider was used. I really think the statutes need a comprehensive review of these terms. I think that this type of issue, if it is an error, and I'm not sure that it is, given the conversations that I've had with the Department of Health, and again, as I've said previously, I'm not the Department of Health, so it's very hard for me to say what the Department of Health's policy is. But if it is an error, it happens because we are doing statutory fixes in piecemeal. I think it would be very useful to have this where all these terms are, and then make this very deliberate about the modification of these terms or the express use of these.
I'm losing. Is it
Yeah.
me?
I didn't hear anything you said there the last minute.
So I think that what she's saying actually is that it would be helpful to have a comprehensive look at the statutes to make changes. And I do agree that that would be helpful, but in this case, it seems to me that it's pretty limited here to just what we heard from David Englander was that if the training, they had no issues with it if the training and the both the academic training and the experience in the field was similar to MDs. And in this case, we're not just redefining, we're actually allowing a primary care provider to sign a death certificate, which can be done without looking at all the statutes to decide where we should change the definition of healthcare provider. That's where I'm landing here. Any other committee comments or? Yes, Senator Ram.
Well, I wonder maybe if it's a question back to Dr. Russo, does this feel urgent? Could it be done as part of a more comprehensive review and wait a year? It didn't sound like there were a lot of naturopaths who were, their door was being knocked down to sign death certificates.
I wouldn't say it's an urgent issue, but it is a pressing issue. So as of last fall, we had one naturopathic doctor who had been denied this ability, and it wasn't found out until after the fact. And that resulted in the family having to deal with the situation, which was very stressful. That it causes, emotional harm. That is protection of the public that did not occur. In my situation at the Community Health Center, I've been asked to sign 3 death certificates over the last year, and I haven't been able to do so because I'm not in the title. So I have to then go and press upon my colleagues to have a death certificate signed. Now, we may not be signing them as frequently as medical doctors, but as we're seeing more insurance coverage for naturopathic physicians, particularly secondary plans, even though we're not covered by Medicare, secondary plans do cover us, and we continue to see people through their end of life. So, I look at this as protection of the public. I wouldn't say this is expanding scope. But you have a situation where I can see or a naturopathic doctor can see a patient from the first day they're born and take care of their health through their life and help them plan for the end of life and even sign their do not resuscitate order. But I can't sign the death certificate. So not only is it unfair to the family, and their medical choices, but it's also putting pressure on our colleagues, our non-naturopathic colleagues, to then take up, extra work when, we are perfectly trained and competent to provide that work.
And you can sign a DNR, but
That's
not a
my
death
understanding. Yeah, and I did cite in the memo which statute I was looking at for that. I have
certificate.
signed.
Senator Ram, did you?
Well, that's kind of my follow-up question. I mean, are there other areas of medicine where you feel limited, where it would be better to look at the broad scope, so we're not back here in 2 years talking about another, area of medicine you're denied practicing, and we do it more comprehensively?
I think there are some areas. I think this is probably the most present one. As Gail Zatz, hopefully we'll be talking with you about, we are seeking some cataloging research to identify some of these discrepancies. I think this is just an example, just where we have multiple provider types that have been dealt with in statute, and sometimes, provider type gets left out, not intentionally, but it's more of a cataloging issue.
And Senator Ram, we will be back here because there are talking about this, because there are multiple places in the statutes where we define healthcare provider, and naturopaths are not included in there. So whether we do something today or don't do something today or this year, we will be back. Senator Clarkson, did you have a question?
I did, but Keisha's question answered. I think Dr. Russo's answered it. Thanks.
Senator Polina?
Thanks. I'm going to ask a question that I know the answer of, I think. So maybe I'm making a comment either way, but I would like you to respond. You mentioned all these other states where naturopaths are allowed to sign death certificates. I presume they went through the same training as naturopaths in Vermont. There's no difference in the training, just difference in the way that the law has allowed them, what the law has allowed them to do.
Yeah, that's correct. So, we're all trained in CNME accredited schools, so we all follow the same curriculum. And then at the state level, if there's a designated program similar to what the Vermont Department of Health has for training on completion of a death certificate, that's going to be up to the individual states to determine, but the general education is the same nationwide.
All right, well, yes, Senator Collmore.
Thank you, Madam Chair. I think I'm a little more sensitive to Lauren's concern than maybe some of my colleagues. I could suggest she could take a look at Dr. Russo's testimony. And were you planning on voting this out today, Madam Chair?
No, I don't think we can, because we still have to look at the other two things. And I think at 2 o'clock, Gail, that I think we switch our topics here.
That's correct.
Yeah.
You're taking on H435.
So we are not voting this out today.
So
because we
we
still
could,
have to hear the effective dates and stuff. I think we had all agreed on Jill Olson's concept. We didn't see the language, but we had agreed with her proposal, and the MMA one we were okay with. So what I would suggest is that, and Gail, I'm sorry you didn't get a chance to talk about the inventory. But if Lauren agrees that we should ask for an inventory, then I'm happy to do that.
May I just offer a comment?
Yeah.
Okay, so I'm Gail Zatz. I'm here on behalf of the Vermont Association of Nurse Anesthetists. And while I presented in writing testimony on behalf of this association, we're also joined in support of this by the nurse practitioners, as well as the nurse midwives, and of course the NDs. And the language that we're asking for, I had previously submitted when the testimony was scheduled in previous weeks, but I can resubmit it if you like, if that would make it easier. But it's essentially the same language that we proposed in 2012 that the committee adopted in the OPR bill at that time to create a catalog by legislative council. And so that's the same language that we're asking that this committee adopt in this bill.
Yeah, and it doesn't make any changes. It just creates this catalog, and then we can.
Exactly. We're not.
Can,
yes, we're not asking for any
right.
amendments to any statutes, and nor are we asking for any expansion of scopes of practice.
Right. Yeah. So this committee in health and welfare would look at that next year and make some decisions. All right. So committee, Lauren, yes.
I just wanted to say, hopefully my internet is more stable. I apologize for that. Competing, I have a tween in the house and I just told them to get off the internet. So I really support the inventory. I think it's a good idea. I know that it will be increased work for legislative council, and so I apologize to Ameren in advance, but I think that these conflicts in the statute are right, and they come from well-intentioned ideas of modifications having unintended consequences, and sometimes intentional choices that then we don't understand in reviewing the statutes at a later time. And the only other thing that I wanted to say is that I can tell from my email that David Englander is available to testify on naturopath death certificates at the next time that you take this issue up.
Okay. So I am not sure. The schedule has gotten so crazy, and we're dealing with the retirement pension bill whenever we actually get that. So I think that we'll be spending Wednesday and Thursday primarily on that. So maybe, Gail, we could reschedule this for Friday. I know we kind of had a little fluid schedule on Friday, and maybe we can talk about getting this in someplace.
Madam Chair, I think that would be certainly feasible.
Yeah, okay. So maybe we can have this conversation on Friday about the effective dates, the other section that Ameren talked about, and this.
And would you like me to resubmit the proposal for the catalog, the proposed language?
It should be on our website, on our committee page. So I think
you just have to look under your name to find the testimony. It should be there.
Yeah.
Look under the witness list.
Yep.
Yeah, or and tell us the date, whatever. We'll find it. We don't need to find it right now.
It pops up. Well, actually, Gail, I don't see Gail's name.
It should be under Travis Knapp.
Yeah.
I believe he submitted it previously.
Yes, he submitted it.
Got it. Thanks. Because it didn't come up under Gail.
Okay. Is that okay, committee, and I apologize for this very short little thing here. I actually thought it was going to be faster, but you never can tell.
Well,
So yes, Senator Clarkson.
yeah, and thank you, Dr. Russo. That was your testimony was, I think, very helpful for us. So thank you for taking time between patients. And are we right that there are just over 50 naturopaths in the state?
Yes, licensed in, there are more that are licensed that aren't in the state, but as far as who are practicing in the state, it's around the mid-50s. I'd also like to make myself available Friday for answering additional questions, if that's
sure.
possible.
And we'll make sure that Lauren has time to review your testimony, and also David Englander to review your testimony. So make sure he gets it. Okay.
Yeah, thanks. It's very clear and was very helpful as you were presenting it.
Thank you.
Okay, do we have any, this is just a side question, but I have 1 minute to ask you. Do we have any death doulas in Vermont? My sister-in-law is a death doula.
Madam Chair, we do have death doulas in Vermont. They're not licensed or regulated in any manner, but they are here, and it's actually very interesting. Cabot has been working with UVM to create a program because it was identified as one of the areas that farm families really cared about. So there is a death doula program. UVM runs one, and they are not regulated or licensed at this time.
My sister-in-law teaches some through University of Minnesota. Yes, Senator Clarkson.
So is a death doula in lieu of hospice?
No, they work with the person and the family, and it's a loving kind of person who isn't emotionally connected to, I mean, who can be somewhat objective and give that support and that space to the person and the family. That's the way I understand. My sister-in-law became one after her husband died, and she had support from friends, but she wanted more. So
similar in concept to a birth doula,
right?
It's non-medical, non-legal, non-family support. So a birth doula would come in and be a support to the birthing person. A death doula provides support to the dying person.
And to their family. She works a lot with their families.
And do they need a diagnosis of, as we do for hospice or for our other programs for end-of-life care and end-of-life choices? Do they need a diagnosis of to be referred to?
Well, they're not regulated or licensed or paid by insurance or anything like that. So if somebody, my guess is if somebody feels like they are dying and they want to have a death doula, they can have one, whether they have a diagnosis or not.
Just curious how people know about them or who refers them, and what's the
Anyway, I'm sorry I got us off on that conversation, and I see that we have Damian and Representative Coffey with us, and I think Commissioner Baker is joining us. So thank you very much. I'm sorry I got us off on that tangent.
No,
thank you for the opportunity to speak.
Thank you.
It's appreciated. Have a good day.
Thank you. Thank you. You're certainly welcome to stay.
I have a very patient right now. So
okay, great.
Thank you.
Commissioner Baker will be joining us shortly. He's just running a little bit late.
Yeah, that's just fine. So I think what we'll do is, committee, this is H435. And I think that what we'll do is we'll have Representative Coffey just talk a little bit about kind of the genesis of this and where it came from and why they feel it's important. And then we'll have Damian, without detail, you don't need to go into detail because Damian will walk us through the bill itself, but just kind of give us the background and where it came from. And you know all of us, I assume.
Yes, I think
okay.
I think we've met. It's a pleasure to be with you, Madam Chair, and your committee, and to talk with you about our committee bill that came out of House Corrections, H435. So I'll just dive in a little bit, and I just wanted to give a little bit of context for why this bill, the urgency for this bill, and what it's all about is. As some of you might recall, back in December of 2019, 7 Days published a long form article that described disturbing allegations of sexual misconduct, drug use, and retaliation at the Chittenden Regional Correctional Facility in South Burlington. And soon after that, you might recall that the Commissioner of Corrections stepped down. The Secretary of Human Services brought in an interim commissioner, and the Secretary also authorized an independent investigation by the law firm of Downs, Racklin Martin, DRM. And so DRM embarked on their investigation, and before the pandemic, they were anticipating to be able to present their report to us in April of 2020. But as we know, many things have changed. But back in before the pandemic hit, in the winter, January and February of 2020, our committee was pretty rattled by, to say the least, by these allegations. And we did hear from the interim commissioner, James Baker, and DOC staff reporting and really confirming that there was a sexualized environment within the Department of Corrections. And so it was not a huge surprise when Downs Racklin Martin came back with their report in December of 2020, some of the confirmations of these allegations. So I wanted to share a little bit. I'm not sure if you're going to have time to hear from Downs Racklin Martin, but there was an 87-page report that they issued, and they came into our committee in January and gave us close to 3 hours of testimony. And I just wanted to highlight some of the areas in that report, because that report in many ways became the blueprint for this bill. So some of their process was that they interviewed DOC staff, including current and former managers at the Chittenden Regional Correctional Facility, which I'll refer to as CRCF. And they also interviewed corrections officers and caseworkers. They engaged the MOS group, which is a nationally recognized group of experts that work in correctional best practices at women's facilities. They organized several roundtable discussions and individual consultations with principal service providers at CRCF and with incarcerated women there. They engaged in private investigations to assist in interviewing women who are currently or previously incarcerated, as well as former and current DOC staff regarding their experiences at the facility. And they also did a review of AHS and DOC documents, including policy directives and investigative reports. So their investigation confirmed a disturbing number of allegations of sexual misconduct by officers at the women's correctional facility, which targeted both inmates and fellow staff members. The 87-page report painted a picture of a correctional system that was plagued by structural and human resources challenges. So I want to pause here because I think it's important to say that this bill is not about targeting our correctional officers or sending them. We know that these folks do good work, but this bill we believe is both for the staff and for the people who are under the custody and care of our correctional officers and the Commissioner of Corrections. So I just want to be clear about that, because you might hear that that is targeting them, but really we feel like our correctional officers need to have the training and tools so that they can succeed in the people who are under their care. So I'd like to just read something from their report that really popped out at me, if that's okay, Senator White.
Sure.
So this was quoted from their report, and I think says a lot of it. So, quote, "All types of sexual misconduct are abhorrent and unacceptable, yet sexual misconduct involving DOC staff and the residents of CRCF raises unique concerns. The power imbalance between residents on the one hand and COs or corrections officers and other staff on the other simply cannot be overstated. At CRCF, as with any prison, COs have control over the residents' lives to a degree that would be unimaginable to somebody unfamiliar with prison. Thus, the women living at CRCF are a particularly vulnerable population. This vulnerability is enhanced by two factors which were frequently mentioned by DRM, by residents and staff alike. First, many of the women at CRCF arrive at the facility having already experienced sexual violence and trauma during the course of their lives. Second, many of the women at CRCF suffer from either mental health issues, substance abuse, or both. These factors not only make the residents of CRCF more vulnerable to potential sexual predation by staff, but also render the consequences of that predation more harmful, both to the victims and the greater community." So I think I might pause there, and I can tell you more specifically about what's without a section by section of what's in the bill, because I know you have legislative counsel here to do that. But I think in summary, at the heart of this bill is an independent commission. It's a corrections monitoring commission with appointments by folks, the governor, the various the judiciary, and other folks that you can see in the bill. Secondly, there's a special investigative unit that, after we heard a lot of testimony from human resources, we saw that we could really see that there was a gap and a need for this. And third, working with developing a system for training, better training and certification and decertification, and relying on the help of the Crimes Victims Council. So, and you know, a lot of this is probably going to be more familiar to your committee. We relied heavily on some input for one section of the bill on our Judiciary Committee, on the section that expands expands the criminalization of relationships between DOC staff and folks who are supervised. And we also brought in some members of our House GovOps committee, because a lot of this work in commissions is really more familiar to them and probably to all of you. So I think I will pause there, because I know you have other folks here, but I'm happy to answer any questions or stick around to hear any questions that you might all have. I hope that's helpful.
Thank you, Representative Coffey. Senator Clarkson, do you have a question about the bill specifically?
About Sarah's last comment.
Okay.
I mean, I think, thank you, Sarah. That was very helpful, and it gave a great overview of it, and your work, and how important that work was for your committee, because I know it was. I'm just curious why, because we don't want to duplicate efforts. Why is the current Corrections Oversight Committee not enough to do this work?
Can I suggest that maybe if we walk through the bill first, we might have a better idea of what's actually in the bill, and then we can ask that question.
And may I add one just last comment too, is like, this was a very, there were some issues that and I see Commissioner Baker's here with us. We worked very closely with Commissioner Baker and got input from a lot of different folks, as you can see from a witness list of, but also there were some things that we felt like, we know that the commissioner is doing within corrections, but we felt that there were some things that needed a systemic approach. It's a systemic problem that required a systemic approach. So we worked pretty closely with the commissioner, but we also heard from a lot of other folks as well.
Senator Rahm, did you have a question for Representative Coffey?
I did. Thanks, Representative Coffey. I think you're urgent for a lot of reasons, particularly as an interim step. But have any of the groups that you're part of, either committees or caucuses, talked about the potential final best practice of closing the women's prison and not having so many women incarcerated for property crimes?
That's a terrific question. And actually, that was one of the recommendations. Those replacing the facility was one of the recommendations. And that's obviously not in this bill. That's in some separate legislation that we're working on. It's in the Capital Bill, which also does happen to fall on our committee. And I think we are at an interesting crossroads with that, looking at different approaches to that. And I know the commissioner's here and he could speak to that as well. But yes, I think that is a part of it, alongside with the work that we've done with justice reinvestment over the past several years. I feel like it's all part of a larger picture and initiative that our committee and the legislature has been working on to really address and create systems that are rehabilitative. As we know, the majority of these people are returning to our communities, and what it requires is also retraining and recalibrating of staff so that we can deliver those services, but also to have a more humane environment for for everybody who's working there and who's residing there. So that's your point is well taken.
I would like to make sure that we don't go too far off in that direction, because that's in a whole separate bill, and just given our time constraints, I think we need to focus on this, and hopefully we'll be able to weigh in with institutions on the replacement of the women's prison and what that looks like. All right. Any other questions for Representative Coffey? And you are welcome to stay with us. Oh, I'm sorry, Senator Polina. You're muted.
You're muted, Anthony.
Sorry about that. If this is too far afield for now, let me know, but I'm wondering whether your committee, Representative Coffey, has heard about or taken a position or looked into the idea that I'm hearing from constituents that the Department of Corrections is stopping contracting with transitional housing for women. If you're familiar with that at all.
I am familiar with that. I think actually we're going to be hearing about that this week. So I really can't respond right now. I think the commissioner might be in a better position to do that. I see he's here.
It just seems like trauma affected women who are leaving prison obviously need a place to go where they feel safe and are treated well. And this would make that much more difficult. But
yes.
So we can talk about it another time.
Can I just throw something in here that there are about a bazillion issues around corrections, and the House committees are dealing with it, and Judiciary is dealing with them, and our Institutions Committee is dealing with them. And I just don't want us to get so far away in the little time we have left that we don't have time to actually deal with this bill.
Yes.
Sure,
I mean, there are lots and lots of issues around the Department of Corrections in the institutions and outside in the communities that the commissioner has been working on. And I just want to be very careful that we don't use up our time on those issues and not get to this bill.
Senator, if I could, Senator, I think I respect, but I've got to respond to that. And
Okay.
Senator Polino, nothing could be further from the truth. There's a lot of rumors floating around right now. We're going to be testifying in House Corrections Institutions tomorrow, and it's too big to get into right now, but I've got to be on the record to push back against that statement. A lot of people are making a lot of statements about our transition to a new form of housing that have lost our contract, and your statement, wherever it came from, is misinformed. And it's got to be on the record to be able to push back against that, sir.
I appreciate that.
Thank you. That was helpful. All right.
Madam Chair, may I just have one final comment? Not about that, but about the bill.
Yep.
Just that there are a couple of things that are not in this bill that are elsewhere. That I want to be clear that there's a section on to study polygraph and drug testing. That was something that came out of the DRM report, but we are requesting that the Joint Justice Oversight Committee look at that and come back to us next year. Body cameras was also an important part of the report and recommendations, and that also is outside of this bill, and it will be taken up. And I think that's it. I just wanted to be clear that there are a couple of things that were not, that were in the recommendations by DRM, but are not in this bill and are elsewhere.
Good. Thank you. So Damien, would you like to walk us through the bill so that we actually know what it's in here? It'd be helpful for us to know what is in here before we start discussing it.
Sure. I'm going to actually recommend that Amarin walk you through from sections 2 to the end of the bill, because she drafted the majority of those sections and knows more about them than I do. And then I'll take you back to section 1.
Okay, you'd like to do it in that order?
Yeah, she has to go to another committee, so this will utilize her time with the committee to the best effect.
Thank you very much for your consideration. So Amarin, would you like to start us through on page 4, section 2?
Sounds great. So page 4, section 2, this would add section 123 to title 28, section 123, Department of Corrections Monitoring Commission. Subsection A, there is created the Corrections Monitoring Commission to provide advice and counsel to the Commissioner of Corrections with regard to the Commissioner's responsibility to manage the reporting of sexual misconduct, promote adherence to anti-retaliation policies, ensure overall policy implementation and effectiveness, improve the transparency, accountability, and cultural impact of agency decisions, and ensure that the determination of investigatory findings and any resulting disciplinary actions are just and appropriate. Subsection B outlines the membership of the commission. The commission shall be composed of the following 7 members. A former judge with knowledge of the criminal justice system appointed by the Chief Justice of the Vermont Supreme Court. B, a retired attorney appointed by the Department of State's Attorneys and Sheriffs. C, a former corrections officer appointed by the Vermont State Employees Association. Moving on to page 5, D, a formerly incarcerated individual appointed by the Defender General. E, the executive director of the Vermont Network Against Domestic and Sexual Violence, or designee. F, a former management level employee of the Department of Corrections with experience in corrections management appointed by the governor. And G, an individual at large with knowledge of and experience in the correctional system, crime prevention, human resources, or compliance appointed by the governor. Subdivision 2, no member at the time of appointment or during membership shall be employed by the Department of Corrections or work in any part of the state correctional system. To the extent feasible, the appointing entities shall appoint members that will create a diverse commission, including gender, racial, and cultural diversity. Commission members shall demonstrate an understanding of and respect for the values, dignity, and diversity of individuals who are in the custody of the Commissioner of Corrections and those working within the state correctional system. If an appointing entity is unable to find a candidate for appointment to the commission who meets the criteria of subdivision 1 of this subsection, the appointing entity may appoint an individual with relevant lived experience. Moving on to page 6, subsection C, powers and duties. The commission shall have the following duties. 1, provide advice and counsel to the Commissioner of Corrections in carrying out the Commissioner's responsibilities. That's including reporting of sexual misconduct, overseeing implementation of department policy, creating transparency, and implementing policies related to misconduct, and review of disciplinary actions. 2, monitor the department in the following areas: the timely reporting of allegations of sexual misconduct, compliance with the Prison Rape Elimination Act, the department's implementation of and adherence to policies relating to employee misconduct and discipline, employees' adherence to department policies, procedures, and directives, particularly to Code of Ethics and anti-retaliation policies, maintenance of an independent reporting hotline to the state police, and investigations of employee misconduct, the movement of contraband in facilities, threats to personal safety, and the department's response to major events that occur in the Department of Corrections, including the death of an individual in the custody of the Commissioner of Corrections and the escape of an individual from a department facility or department custody. And 3, now I'm on page 7, beginning on January 1st, 2023, submit an annual report to the Commissioner of Corrections, the Secretary of Human Services, the House Committee on Corrections and Institutions, and the Senate Committee on Judiciary, reporting on metrics that assess the department's performance in the areas identified in subdivision C2 of this section, including listing the number of complaints of retaliation and complaints of sexual misconduct and the outcomes of those complaints, identifying areas of repeated noncompliance with policies, procedures, and directives, and providing recommendations for improving compliance and eliminating instances of sexual misconduct in the Department of Corrections. Subsection D outlines member terms. The members of the commission shall serve staggered 3-year terms. A vacancy created before the expiration of a term shall be filled in the same manner as the original appointment for the unexpired portion of the term. A member appointed to fill a vacancy before the expiration of a term shall not be deemed to have served a term for the purpose of this subsection. Members of the commission shall be eligible for reappointment. Members shall serve not more than 2 consecutive terms, and a member may be removed by a majority vote of the members of the commission. Subsection E at the bottom of page 7 and into page 8 concerns meetings of the commission. The commission shall annually select a chair from among its members at the first meeting. A majority of the membership shall constitute a quorum. The commission shall have the administrative, technical, and legal assistance of the Department of Corrections. Subsection G, The creation and existence of the commission shall not relieve the commissioner of his or her duties under the law to manage, supervise, and control the department. H, reimbursement. Members of the commission shall be entitled to receive per diem compensation and reimbursement for expenses in accordance with 32 VSA 1010. Section 3 is a sunset of this commission. So this commission would sunset on as of July 1st, 2025. And then Section 4 outlines the implementation of the commission.
And Ameren, just to save you time here, I don't think you need to go through whose terms are staggered when.
Perfect. Thank you, Madam Chair. So the members shall be appointed on or before December 1st, with the terms officially beginning January 1st, 2022. You'll see in subsection C on page 9, this outlines how the terms will be staggered. And then following the staggering, the member terms shall be every 3, the term shall be for 3 years. And that is it for the commission. Moving into section 5 on page 10 is the Corrections Investigation Unit. So I'll stop for now.
Yeah, I think that if there are clarification questions for Ameren on this section before we move on, but just clarification questions. Anybody? I have one on page 6. No, not on page 6. On page 5, it says no member at the time of appointment or during membership shall be employed by the Department of Corrections or work in any part of the state correctional system. What does work in any part of the state correctional system mean if they're not employed by the department?
Perhaps Representative Coffey would be available to share some of the conversation around that particular aspect. When it was in committee, I believe the concern was that there are members of the larger correctional system that don't necessarily work for the Department of Corrections, but are involved maybe in either organizations or entities leading into the correctional system or as they are exiting the Department of Corrections. And that also may be on contract with the Department of Corrections to provide services to the department.
Okay, so that would mean anybody like working for HCRS, if they were working with transitional people coming out of prison, or people working for COSA community justice centers, any of those people at all.
Transitional housing, all that.
Okay. That was, any other question? Okay. All right, should we go on then to section 5?
Yes, section 5 begins on page 10. This would add section 124 to title 28. Section 124, Department of Corrections Investigative Unit. There is created the Corrections Investigative Unit, the CIU, within the Department of Corrections. The purpose shall be to investigate allegations of violations of the Prison Rape Elimination Act, major events that occur in the department, including the death of an individual in the custody of the department, or the escape of an individual from a facility or the custody of department staff. Department compliance with policies, procedures, and directives, the movement of contraband in facilities, and threats against the personal safety of department employees and individuals in the custody of the department. B, staff. The Commissioner of Corrections shall appoint and employ sufficient staff and adopt the necessary procedures for the CIU to carry out the duties required under this section. Subsection C Coordination. The CIU shall coordinate with outside investigative agencies and law enforcement agencies concerning criminal allegations and shall coordinate with a designated point of contact at the Department of Human Resources on employee misconduct investigations and disciplinary actions. The CIU shall conduct personal safety planning as necessary for employees who receive threats.
Are there any clarification questions on this section? I have some questions, but I think they're better asked to the commissioner, so. Okay. So
Now,
section 6.
Section 6 and 7 are actually sections that were drafted by Bryn Hare. I can read them, but I don't have any real background on them.
Why don't you go through them, and if we have
Okay.
questions around them, I'm sure that Representative Coffey or the commissioner, or we can get Bryn if we need a technical explanation.
Right. So section 6 on page 11 would amend section 3257 of Title 13. Section 3257, this would amend the section heading to delete the words an inmate and instead say sexual exploitation of a person under the supervision of the Department of Corrections. This is, it looks like in subsection A, it is mostly a technical correction, changing this to say a correctional employee, and then finishing with shall not engage in a sexual act with a person who the employee, contractor, or other person providing services knows is confined to a correctional facility, or any offender being supervised by the Department of Corrections while on parole, probation, supervised community service, or furlough, where the employee, contractor, or other service provider knows or reasonably should have known that the offender is being supervised by the department, unless the offender and the employee, contractor, or person providing the services were married, parties to a civil union, or engaged in a sexual relationship at the time of sentencing for the offense for which the offender is being supervised by the department. So you'll see there on page 11, there is the deletion of the language that would say that if they are currently engaged in a direct supervisory relationship with the person being supervised. And this would expand circumstances of this prohibition. And then section 7 is a separate section. Would you like me to pause here?
Were there any
Chair?
questions on section 6? Nope, I guess section 7.
All right. Section 7 is the Criminal Justice Council Department of Corrections certification process. During the 2021 legislative interim, the Criminal Justice Council and the Department of Corrections shall develop a proposal governing minimum training standards, complaint investigations, and a process for certification and decertification of correctional officers as defined in Title 28, Section 3. The proposal shall give the council the authority to investigate allegations of correctional officer misconduct and to certify and decertify correctional officers. On or before December 1st, 2021, the council and the department shall report the proposal to the Joint Legislative Justice Oversight Committee, including any fiscal and programmatic impact of the proposal. And the effective date of this act shall be July 1st, 2021.
Great. Any questions for Ameren? You have to scoot, do you?
I can stay for about 10 minutes.
Okay. All right. So Damien, if you want to walk us through the section 1, and then we'll open it up for testimony and comments and questions. Okay.
Okay, thank you. So section 1 starts on page 1 of the bill. And this is a study done by the Joint Legislative Justice Oversight Committee. And it directs them to study 2 things. First is permitting the DOC to administer polygraph examinations to certain applicants for employments. And then second, to conduct drug testing of certain employees. So with respect to polygraph examinations, the committee would be directed to look at the positions for which that would be appropriate, the cost of administering those examinations, whether they're an effective supplement to the department's existing background investigation procedures, and whether any potential alternatives might be more effective for the department. Any issues related to the use, retention, storage, and destruction of the information obtained, and the potential benefits and drawbacks of the department using them as a screening tool. And then with respect to drug testing, the first question again is whether the department could benefit from the ability to conduct drug testing to a greater extent. than is currently permitted under state law. As some of you will know, drug testing is currently permitted under Vermont state law, but the standard for it is a probable cause standard. So and it doesn't permit, for example, random drug testing or facility-wide drug testing or instances where there may be a reasonable suspicion. And so that has raised issues in the past that have been discussed in the legislature, although the standard has never been changed. But this again would look at that from the perspective of the Department of Corrections specifically. The categories of employees for whom the department should potentially be granted the additional authority, circumstances under which the department should potentially be permitted to require employees in those categories to submit to a drug test. And that gets to the random versus reasonable suspicion versus maybe scheduled facility-wide tests, something like that. The next is, again, the same issue. Should the department be permitted to carry out random, scheduled, or facility-wide tests? The potential costs of doing so, whether the existing safeguards and procedural requirements that are already in the employee drug testing law might require modification if the department is granted additional authority, and then potential privacy, safety, and other concerns that might arise in relation to expanding employee drug testing because of the nature of the work environment in the correctional facilities. So, for example, if confidentiality were breached and inmates were to be aware of drug use by one of the correctional officers or something like that, could that create a complication, and how would that be addressed to prevent that from happening? So those are the two primary pieces. And then there is a second piece that says, if there is sufficient time and resources, the Justice Oversight Committee can also study the potential recourse for the department and employees in relation to a positive drug test and the interplay between the collective bargaining agreement and any identified potential expansion of the department's authority to conduct drug testing. So the House decided to make these optional for the Justice Oversight Committee for really two reasons. One was recognizing that that committee has a great deal of work that it's expected to do in the interim. And also that these are issues that are probably going to be discussed at significant length if there's a recommendation put forward to the General Assembly to change the law to permit expanded drug testing of correctional employees. And that these are also fairly complicated issues that may require a lot of sort of specific attention in any bill that comes forward proposing to expand drug testing. And the report would be due by December 15th. Questions on that section?
Any questions of Damien? So this isn't a question, but I am going to say that I think that when we look at this, at this section, we should look at the guts of it and what it's proposing to do, but not where it lives, because I've already heard from the Justice Oversight Committee that they cannot take this on. So if we think it's important to do, we have to figure out some other place to put it, because they've already weighed in on that. I just throw that out so that we will be thinking about that when we're addressing this section. So any other questions or comments right now? All right, so Senator Rahm.
I'm just trying to understand the drug testing piece a little bit better, sort of the House intent maybe around it. So that's become optional, but it's still important to the bill. I'm confused.
No, so the majority of the drug testing study is required.
Okay.
The last two parts of it, which are really looking at what happens when an employee tests positive, what's the recourse for the department and the employee, and how is this going to impact the collective bargaining agreement, and are there adjustments that would need to be made to respect that? So there are a number of sort of things that are at play here. One is under our collective bargaining agreement, there are already a number of protections in terms of discipline and so forth and how that works. And so this really would require some sort of detailed analysis of where that stands. And then the other thing to really keep in mind with this is if the state has entered into a collective bargaining agreement that grants the employees in the corrections unit certain rights, we can't in the middle of that agreement take away some of those rights. We have to wait. It has to be prospective for new agreements. And you'll want to consider sort of the impact of that on the agreement. As this committee is very aware, anything with collective bargaining is a give and take, and we have to be really careful just not to legislatively impair some of the things that the state has already bargained, given to, for example, the employee bargaining unit in exchange for something else. So that's really why that's held out as a separate piece, because it really gets away from the issue of, is drug testing feasible, cost effective, and reasonable in this situation versus what's permitted under statute, and gets more into the, how is this going to affect the state's relationship with its union?
Okay. The only other comment I have, and maybe the Representative Coffey has a reaction, is I just don't think one formerly incarcerated person is enough. I feel like that's asking a lot of a really critical perspective to just have one person who's experienced incarceration.
Well, I think that, I mean, there are a number of issues in this bill that I have. So
Okay.
I think that as we go through, we will certainly be making changes, is my guess. Although maybe not. But Representative Coffey, do you want to address that?
You know, about the drug testing or the
the one person on the.
I think this came into our thinking towards the end of our process, and so we wanted to include somebody, but if I don't think there are strong feelings that it only be one person, I think there's room for more. So.
All right, so can we hear from Commissioner Baker, and then we'll hear from Steve Howard. And I have a lot of questions and concerns here, but I'll open it up to Commissioner Baker first.
Good afternoon, everyone. For the record, I'm Jim Baker. I'm the interim commissioner of corrections, and thanks for getting this on the schedule, Madam Chair. I think maybe the best place to start is just for me to make a couple comments about where corrections is on the bill, and then open it up for questions, because it sounds like there's a lot of questions. And I mean, I think it's as simple as this. The Department of Corrections worked very closely with House Corrections and Institutions when they were putting this bill together. We're supportive of the bill. We're supportive of the intent and the concept, and it really is following many of the recommendations that came out of Downs, Racklin, Martin report, taking a look at the women's facility in South Burlington, and that started my tenure here as the commissioner, about the reports in 7 days of sexual harassment, abuse at the facility. And this bill was meant to address some of the recommendations that were in the DRM report, along with the work that we're doing. Besides the language in the bill, we are doing a lot of work at the facility now based upon the report and our work that is ongoing with the Moss Group. So I'm going to leave it there, because instead of me talking about it, I think the best is for me to try to answer questions about the operational pieces of what is in this proposed legislation.
Committee, does anybody want to kick it off? Or I have some. questions. So Commissioner, why do you need legislative approval to, or put it in statute to form an investigative unit within the Department of Corrections? I mean, isn't that something that you can just do within your own department?
I could do that, and the next commissioner could do away with it. And I think that's the reason why when we were in House Corrections and Institutions, it may not seem on the surface to be that important that you could just create it, but I want it to be institutionalized because you heard Representative Coffey talk in the beginning. What I've discovered is, like in many situations, the challenges that are faced in corrections and many times are institutionalized. And what my recommendation to HCI was that by putting this into legislation, it's there and it's required. And somebody down the road can't change their mind about it. And I certainly can go into many, many examples since I've been here of why this is an important piece, the least of which is our obligation under PREA and our federal obligations of how we deal with sexualization in the workplace. We struggle with trained, focused investigations. We need to have a level of expertise in the department that can manage and make sure that we're in compliance with the PREA regulations.
Anybody have questions right now? So I do have a question about the Criminal Justice Council and the setting up the training. And the second sentence there, the proposal shall give the council the authority to investigate allegations and to certify and decertify. Isn't that a little bit ahead of ourselves, since we're just asking the council and corrections to come up with some standards around that? And yet we're giving them the ability to decertify people before we've even set up a process for certification, because we don't have any certification process now, right?
That's correct. That's correct. I'm trying to digest what you just said, Senator, right?
Well, when I read it, it says that they should the two of you should get together and develop a proposal for governing minimum standards, complaint investigation, and a process for certification and decertification. Then it says the proposal shall give the council the authority to investigate allegations and to certify and decertify. But it seems to me that we're giving them that authority before we've even set up any kind of a system. It's just a.
So my memory is this, of the testimony in HCI, was that the intent was to work with, well, first of all, when the conversation came up, where do you put certification and decertification of corrections officers and probation and parole officers? That's what we're talking about. Where do you put it? Well, the Criminal Justice Council seemed like the likely place. But when that conversation went on, I'm certainly not talking for Representative Coffey, and if I'm misstating something, I would hope that she would straighten me out on it. But the conversation came up about how complicated this would be because it's never been done before. I think the intent here is that the proposal that comes back from working with the Department of Corrections and with the Criminal Justice Council is that proposal would in fact give the authority to the training council, much like it does for certification and decertification of police officers. That's what my memory is and what the intent is.
I get that. I just still think that it's a little premature to put it in there when it hasn't even been, the proposal hasn't even been set up or approved yet. So anyway, that's Senator Clarkson.
So thank you. I'm completely puzzled. Are we saying that there is no certification process for correctional officers?
Yes, they're hired just like everybody else is.
I guess I'm just stunned by that. I guess I'm surprised by that. I thought that in workforce development training, we had programs that certified them. I thought we had those opportunities all the way through. So I'm fascinated we don't. Anyway,
Well, I think what I would say to that, Senator, is that they're certified in the sense that they go to an academy,
yeah,
receive certification internally, but they're not, so, but there is no outside organization that has oversight of certification and decertification for accountability purposes when it comes to corrections officers and probation and parole officers.
got it.
I hope that helps kind of clarify.
Right. Thanks. Okay. That helps.
So other questions? I know Senator Ram, yes, Senator Ram?
Well, I don't know what you were going to say, but I was just wondering if the commissioner could speak to any improvement in current metrics that you're following, any places you've seen success, fewer complaints. Do people know how to make a complaint better? What are some ways that we're improving the situation now?
So, Senator, are you talking specifically about the Chittenden facility, but
Yes,
in general? Yeah, I think I would not do it justice, the work that's being done by Superintendent Messier and the leadership team we put in place. If I didn't take, and I don't have it here with me, I'd have to look it up. But Superintendent Messier is doing some incredible work on programming, working with Dr. Kathy Fox from UVM. We're doing that, and I'm giving you kind of the treetop view here. Doing work in a mentorship with the state of Maine. We're working with other female wardens from around the country in a mentorship program that are wardens that have oversight over other female institutions. This week or next week, we've launched some training that's focused on gender and trauma specific recognition. It's the Train a Trainer program. And I mean, I pulled a staff member from the field to oversee the recommendations in DRM, and he's reporting directly to me. And we just promoted 2 new assistant superintendents that we are working with. We're in the process of identifying a new director of women's services that was eliminated in a budget cut a number of years ago. So I could go on and on about what we're doing. We have seen less complaints. In general, across the system, I have seen a drastic change in the reports of employee conduct and allegations of misconduct by employees since I stepped into the office in January of 2020. And again, I don't have statistics to measure against. I'm giving you my impression of my bi-weekly staffing that I do about conduct of employees.
So, yes, Senator Clarkson.
Jim, do you have an equally challenging a problem with retention at the Chittenden Correctional Facility as you do at the others? I know it's a huge challenge that you face in corrections. And I know I assume under your leadership it's improving, but I also know that the pandemic's had an effect on it as well. So do you have the same challenge at Chittenden as you do with the others?
I don't think it's as, look, let me say this first of all, we have a challenge retaining folks. And I've said this many times in several committees, and I've said this publicly. We don't have a problem recruiting, we have a problem retaining. And,
sorry, I didn't hear you.
We don't have a problem recruiting, we have a problem retaining.
Right, yes,
So
I know.
we have a class going in a week from, well, next Monday, in fact. A class is going in, a week from next Monday. It's hard to believe we're through April, and I'm thinking we're halfway through May already, but I'm getting ahead of myself. We have a class going in right now of 26 new corrections officers. We have a real problem retaining people, and we are looking at that. I don't think Chittenden sits in the same space as some of the other facilities, but it's still challenging retaining staff.
So I have a question about the one of the duties of the commission is to maintain an independent reporting hotline to the state police. And I wonder if that really is the best place to have a reporting. I mean, if you're reporting to the state police, it sounds as if there's a crime that's been committed, because And I wonder if there was thought given as to a place to have a hotline for reporting incidents that wasn't connected to law enforcement.
Yeah, so what we're referring here, and I think you know this, Senator, but just for everybody's clarification, what we're talking about is the hotline inside the facility at Chittenden for the incarcerated population to report activity. And when I first came, this was in the works and went back and forth. We tried to figure out the best way to do this. I think Representative Coffey remembers these conversations well from the Women's Caucus, when I reported into the Women's Caucus on this. And we had a very hard time finding someone that could staff a phone 24 hours a day. And the best option we had at the time was having the state police answer that. I believe it's gone fairly well. I think we get the information timely. And remember, if there's an allegation of any type of sexual conduct, it opens up the window to a PREA review. And again, for the senators that may not be aware, I'm talking about the Prison Rape Elimination Act, which is federal standards that we have to follow. And so that was the best option we had. And it seems to be working for the time being.
Thank you. And yes, Senator Clarkson.
Sorry, Jim, when was the Prison Rape Elimination Act passed?
Boy,
I think Representative Coffey, did you know?
I think it's 2003 or 2004.
It hasn't had much impact. I mean, rape is so rampant in prison. It's just, I can't believe it's been that long, 18 years, and we have so little to show for it.
Well, you know, I'd have to get my PREA coordinator in to have that conversation. I don't know how to respond to that with 16 months experience. What I will tell you, Senator, is I spend a lot of time internally. In fact, I spent an hour and a half on the phone today with the leading expert in the country that we're consulting with about how we handle PREA. And I spent an hour and a half on the phone with her today, just for me to constantly be processing the importance of what PREA represents, what it means, and how we should be handling that. So I can't speak to prior to that, and I can't gauge how much progress we've made. But what I can tell you is I pay attention to this very seriously, and I'm constantly trying to educate myself. And it's really part of the reason why I believe that we need an investigative unit internally.
Right.
So I also have a question about the the makeup of the commission. And I know that it says that nobody should be employed by the Department of Corrections. And I think that makes sense, but we're working any of the state correctional system. And what I'm thinking here is there might be somebody who works for a community justice center who would be very well placed on a committee like a commission like this, or not just a community justice center, but somebody who works in restorative justice or something like that. And that's part of the corrections system if we're expanding it to everybody who has any connection to providing services for people who are under supervision by corrections. So I'm just throwing that out that it might add a different perspective to what goes on, because we're talking about the corrections system here, right? We're not just talking about people who are incarcerated, and they're dealing with people who come out of incarceration. So it's just a thought.
Yeah, and I just for the committees, I'll give you my, when we were working with house corrections and institutions on this, and I came to them with this idea in response to recommendations in the DRM report. I was really falling back on my state police days, right, as the colonel and in the State Police Advisory Commission. And so where I am on this as the commissioner. I think this is, and I heard Representative Coffey say this, I think this is a central piece of the bill. One of the things I've talked about for a very long time since I've been here is that corrections can be the target of a lot of criticism. And sometimes we're criticized about stuff that we can't even respond to because of privacy issues. And I'll voice a little of my frustration here. I have unbelievable employees that work in corrections. I've been around for a while in the justice system, and I have met some of the most caring, empathetic, hardworking, dedicated individuals that I've ever met in my life working inside corrections, especially during COVID. And that story's not told a lot. A lot of stories are told, and there's a lot of allegations that turn out to be, some of them turn out to be true, some of them turn out to be false. But the idea behind the commission, and if I can use an analogy here, is let's open up the curtains to the living room and let's see what's going on in there, because there should be nothing that we hide. And I think in the past, corrections tends to get a little insular. I have a joke inside corrections that I often say to staff: why wouldn't we release that information? We don't carry the code to the nuclear bomb around with us. I mean, there are certain things we can't talk about. People's privacy issues, their medical records. Those are, that kind of stuff we can't talk about. But as far as what we do and how we operate, we should be wide open. So the idea of the commission, and whatever way you all decide to shape this, I mean, there may be areas where I say to you, I'm not really thrilled about that. The only way in I would give here, and to Senator Ram's point about maybe a second incarcerated person, just be judicious about how big you make the committee, right? That it doesn't turn into just a bunch of debate and not the oversight input that a commissioner needs to run a complicated department like corrections. That's all I'll say about it. But we support this. I support it. I know Secretary Smith supports it. That this commission is going to open up and let people look inside our operation and tell us, hey, that's not a good idea. Hey, this is a good idea. Have you ever thought about this? What about this policy? That policy really doesn't respect the dignity of individuals. I mean, that's what we're looking for. So I just put it out there as you think about it, and you're talking about the way this commission should look.
Thank you, Commissioner. I think what we'll do is jump to Steve Howard to hear the responses from the VSEA around this bill. Thank you, Commissioner.
You're welcome.
Thank you, Madam Chair, members of the committee. Steve Howard. I'm the Executive Director of the Vermont State Employees Association. And I am here to speak on behalf of the frontline workers who work both in the field but also in our facilities. And I want to just start, I think, by echoing something the commissioner said. I've worked in this job for 8 years. I've been to every facility, almost every field office. The men and women who staff our facilities are upstanding, respectful human beings, people who Vermonters would be proud to have working for the state. A number of folks who appear to be the subject of this bill are by and far the minority, very small minority of the 400 COs who work for the Department of Corrections. So I just want to begin on that note, because currently, as we talk here, somebody is working a 16-hour shift or 12-hour shift in a building that's less than desirable at a time when we have some of the most violent offenders Vermont has ever had in its correctional facilities. And I just want to give them the credit where they are, where credit is due, and the commissioner, I think, rightfully included them in his comments. I want to just start by also saying that those same members do not condone misbehavior. They don't condone sexual harassment. They don't condone sexual assault. They believe the offenders who are in their care should be treated respectfully, and for the vast majority of them, they are. And that is an important point to make. I also want to just talk a little bit about, I just want to focus, I think, primarily on the legislation, and I'll start with what's not in the legislation and then maybe comment on what is in the legislation, because I think the two are very important. The number one crisis facing the Department of Corrections is a fire that is burning out of control that we cannot seem to get anybody to take seriously is the staffing crisis that the commissioner mentioned and Senator Clarkson rightfully asked about. People are working themselves into exhaustion trying to cover shifts in the Department of Corrections. And we have for years begged the administration and begged the legislature to make it the top priority of the legislature and of the governor, not just this administration, previous administrations. And I can't tell you how important it is that this legislation include a major, as a major component of that, a review of how we treat the frontline staff in the Department of Corrections. We are asking them to do, to work an inhumane number of hours, to spend too much time away from their families, away from their lives. And if you look, there was a shocking statistic that I found in doing my research for preparing for this testimony. The life expectancy of a CO is 59 years old. The life expectancy for the rest of us, 75. They have twice the rate of PTSD than police officers and the general public. They have the highest rates of divorce of any job classification that is measured. 50% of their marriages end in divorce. They have higher rates of alcoholism and drug addiction sometimes, but mostly alcoholism. They have high rates of hypertension. This is an extremely challenging job. And I'll just say that as we look at this issue, let's take a comprehensive look at let's take this opportunity to have a comprehensive look at the whole picture, which is not just how we ensure that the folks who are in the custody of the commissioner are treated properly as they should be, but that the people who are employed by the commissioner are treated humanely and fairly as well. And that is, I think, a gaping hole in this bill. And it is also important because it affects everything else in the Department of Corrections. That is intended to be addressed by this bill. So I want to start with just bringing that to your attention, that the chronic understaffing has an impact on everything else that's in the Downs-Racklin report and everything else that the commissioner spoke about and that the House Committee on Corrections heard. So I would just urge you to make that a top priority, to include how do we solve this problem? And how do we make sure that the offenders who are in our custody get the care that they need, but that also those who are in the facilities with them get the care that they need? That is, I think, critical. And the biggest component of that is to change the culture of the Department of Corrections so that when we recruit somebody, they want to make a career of it. That they want to work in the Department of Corrections and in the facilities. The more experience they have, the more institutional knowledge they gain, the better they are at their job, the better the outcome will be for both the offender and for the state. We have a lot of work to do there. The culture needs to be reviewed. It needs a Downs-Racklin report of its own to see really why it is that people don't want to continue to work for the Department of Corrections. And that, I think you'll find if you talk to correctional officers, is not just the difficulty of being away from their family and the pressure that creates and the massive amount of overtime, but it's the feeling that they are not supported by the management, that they are retaliated against often by the management, and that there is a giant disconnect between those who work in the central office in Waterbury and those who work with offenders directly in the field. So I just wanted to mention that as an important point that I hope this committee will take very, very seriously. In terms of this, I just want to go section by section, I think, on the sections that we have some issues on. So the polygraph, the study on the polygraph, you know, the language that's in there is really about pre-hiring, and for many years, the SEA has called on the Department of Corrections to improve their hiring standards. We don't represent people who are not hired by the department. Once they are hired and they become members of the bargaining unit, then they can avail themselves of the contractual rights of the contract that they have earned at the bargaining table. So on the polygraph test, if the polygraph test does apply to new hires, I think we don't have much of an issue with that. We do think that it should not just be new hires in the facilities, that if management's going to require it of the frontline workers, management should also subject themselves to that standard, and they should also be polygraphed because they have a lot of responsibility in the Department of Corrections, and they shouldn't be treated in any different way than somebody who is in a frontline facility. Drug testing is a little bit of a different issue. There are more serious collective bargaining issues around drug testing. So currently, the statute, the standard is probable cause. We do believe that that is the right standard. We don't believe in random drug testing. And if you hear the testimony of our correctional officers, those who did testify in front of the House committee would tell you that drug use by the correctional officers in the Vermont system is not a widespread problem. And that it's not something that requires drastic action. But we certainly do not believe that it necessitates a standard that the Vermont State Police don't subject themselves to. So that would be, I think, an important thing to incorporate into the consideration of the study around drug testing. And also monitor and really talking to COs about how serious, whether this is a really serious problem or whether this is something else that is being done so that we don't address the most serious problems in the Department of Corrections. The most serious problems will cost the state more money, and that is generally why they don't get addressed. The Monitoring Commission, I think, you know, how that operates and advises the commissioner. I don't think we have much of a concern about how the commissioner gets advice on how to handle situations or whether or the report that's sent to the legislature and holding management accountable. A lot of what our members will tell you is that they make reports to management about misconduct and it goes nowhere. And in fact, the basis of the Downs-Racklin report that's mentioned throughout the Downs-Racklin report is an article in 7 days. And if you look at the main character in that article, you'll see that there was no prosecution of that CO. The state's attorney in that county declined to prosecute. There's been no discipline issued for that CO so far. So there's a lot of allegations in that article, but there are no proven facts at the moment. So we have to be careful before we rewrite the whole statute and rebuild the whole system based on allegations. And you'll see in that article that in the period that from 2011 to 2019, there were 55 complaints about staff at the Chittenden facility. 7 of them were substantiated in that 8-year period. 55 complaints, 7 substantiated. So while we think this is a very serious issue that needs to be taken seriously, and we welcome we think it does warrant some review, we don't want people to believe that that it is a rampant, out of control situation. We also want to make clear, I think it's very important to note, there has been talk about PREA. And it's mentioned in the Downs-Racklin report several times. The department has layers and layers and layers of policies and procedures. And in fact, when asked in the House, the woman who is in charge of the policies and procedures, how many does the department have? She couldn't answer, which I think tells you something. She didn't know how many policies and procedures the department had, but our members will tell you there aren't volumes of them. There really isn't anything that is the current law doesn't address, or that the current policies and procedures don't address. The question is, does the management enforce those policies and procedures? When complaints are brought forward, are they taken seriously? And in the case that's most prominently mentioned in the 7 Days article, VSEA's very proud that it was a VSEA steward who brought those allegations forward. It was management that ignored them. And management is responsible for the culture for enforcing those policies and making sure that those are adhered to. So that has to also be part of this discussion. It can't just be a focus on the COs. It also has to be a focus on how do we improve the management of the Department of Corrections. The investigative unit, we do have some questions about this. I mean, when somebody is under investigation, they, under the contract, do have the right to representation, both during the investigative hearings and, you know, and any resulting discipline. There's a whole contractual procedure, and they have a right to progressive discipline and due process and all of those things that are sort of the framework of a collective bargaining agreement. We wonder about how the union is going to exercise its role in representing and protecting its members during some of these investigations, and what the interplay will be between the investigative unit in the Department of Corrections and the existing investigative units that already exist in the Agency of Human Services and in the Department of Human Resources. There already are 2 investigative units that do these investigations now, in addition to the state police, if it happens to be something that might be criminal. So we do wonder how that's going to play. We want to make sure that the employees' rights to access their union, both their union representative and their legal department, are not in any way infringed by the creation of this additional unit. We have some questions about confidentiality, and, you know, as I mentioned before, a lot of allegations are made. Not as many are substantiated. We want to make sure that while there is an important element of making sure that when someone makes a complaint that people know something is being done about it, we also want to make sure that the person who is the subject of that complaint doesn't have any violation of their right to confidentiality, given the number of unsubstantiated complaints that have been made in the past. So Section 6, I don't know if you want me to talk about Section 6. I think Judiciary has been looking at that. We do favor the existing language. The language that the House Committee put in, I think, is a vast improvement over the original draft of the bill. There are some concerns that we do have in Section 6 about potential retaliation that could occur in some of those situations. If somebody wants to make an allegation that they made one of our members aware of their status with the department, but there's no evidence of that. I mean, that could be a concern that we would also raise. And in terms of certification, certification may go a long way in terms of improving the hiring standards and the career ladder for correctional officers. But we also believe that if you're going to certify correctional officers, the way we certify law enforcement officers, you need to compensate them like law enforcement officers, which would require a subject that this committee has been spending a lot of time on, a review of the retirement benefit that they have, because, as you know, correctional law enforcement officers have a much better retirement benefit. And it's also going to trigger a reclassification of those correctional officers, because if you're certified and you're required to know more and do more in your job, you also need to be compensated more fairly. And as you know, our neighboring states both have more generous retirement packages for correctional officers and also compensate them more than the state of Vermont does. So I'd raise those issues. I'd raise those concerns. Again, I would just say that I think this committee and the people of the state of Vermont can be very proud of the men and women who staff our facilities and staff our field. I know many of you know a lot of them. They are dedicated to the mission of the department. They've worked under very trying circumstances. And in some ways, as we hopefully come to the end of this pandemic, they should be recognized as the sheroes and heroes of this part of this state response, because they kept these facilities together in unbelievable conditions, wearing garbage bags, staying in hotels, doing what they had to do to make sure the public was safe. So I thank you for the opportunity to offer those remarks, and I'm happy to answer any questions you may have.
Well, are you suggesting that under the drug testing that we just completely eliminate that section? I mean, it does seem to me that we're using a different standard for corrections officers here, or people in the corrections system, than we are for every other resident of the state of Vermont and employee. So, Senator Collmore, I'm sorry.
That's okay, Madam Chair. And Steve, I don't mean to cut you off. Thank you for your very brief remarks. Those were appreciated. I do think, and I'm reading section 1, that there is nothing, and maybe Damien can answer, I don't think there's anything to prevent, if we do go with the drug testing, that it does go beyond just the frontline workers. I'm reading it, and I don't see anything that would limit it to just frontline workers. I think anybody that works for the department would fall under that. Am I correct, Damien?
You're correct that it could go to anyone who works for the department. The way it's worded, it requires the justice oversight or whoever ends up doing that study to determine who it's appropriate to expand drug testing for. So that it could end up that the recommendation is just limited to this group of employees. It could be that the recommendation is it should cover everyone in the department, or somewhere in between. One other thing to note is just that this is the state requirement on drug testing. There are certain workers in the state of Vermont who are subject to federal drug testing law, which is more restrictive. For example, truck drivers and bus drivers are subject to federal law on that. But anyone who's not subject to federal law is subject to the very, very limited drug testing permission under state law. So,
thank you.
So I guess I would like some explanation of why we would have this increased drug testing for people in corrections as opposed to state police or people who work in DLC or people who work for in transportation, other than those who are subject to federal law. I mean, I don't think plow drivers are subject to, if they're CDLs, they are. Mm-hmm. But so I guess I just would like some kind of explanation about why people who work in housing authorities and people who work in every place else in Vermont.
It must have been in the DRM report that must have triggered the need, that the committee felt the need for this.
May I, Madam Chair?
Yeah. Would you like?
I think Senator Clarkson said it well. It was really, there's a long section of the DRM report that really, I think it's important. I know your committee deals a lot with law enforcement. Law enforcement officers and corrections officers have some similarities, but there's a lot of difference here. And I think you probably can imagine that. So I think it has to do with a power differential between the people who are being supervised and the people who are supervising. And contraband in corrections can not only be drugs, it can be cigarettes, it can be chewing gum, it can be stuffing for a stuffed animal. I mean, it can, and so I think there's a long section in the report that says it better than I can. And our committee saw that this is really complicated. We knew that it would have it, and it warranted further study. And so that is why we know that there's a lot of complexity here. So I can appreciate that the Joint Justice Oversight Committee might not be the place to do this if they're saying they're maxed out, but I hope that we, before dismissing it out of hand, that we might consider who might be equipped to do that work.
Right.
Did they find that there was more drug use among people in the corrections system than people not in the corrections system? I mean, employees? Is there substantially more drug use?
I think it's fair to say, people who worked in the facilities were extensively interviewed by Downs Rockland Martin. And while I don't have the raw data, I think it's fair to say that all different kinds of folks were interviewed, and they had to do this in a very careful way because of issues around retaliation. And so there had to be some, confidentiality. So I'm pretty confident that they wouldn't have dedicated so much substance in their report and wouldn't have elevated this to being one of their kind of top recommendations without there being substantiation to these allegations. And I think it warrants more investigation and study. And we felt like in the House side, we didn't have the luxury of that time, but also it needed more time. Yeah,
I guess I see that, and I'm sure that they had a reason for their recommendation. If we did the exact same study of employees who worked someplace else, or the employees who worked for the Vermont Bread Company or any other, if we did the exact same study, would we come up with the same recommendation that there's a lot of drug use here that we need to focus on changing our drug testing policies? That's my concern here, is that they only looked at one population, so they have nothing to compare it to the rest of the population, and yet we might be imposing different standards on this population than on others.
Madam Chair, if I could just
sure.
I think just as a reminder that we support the concept of studying this further. I mean, I'm hearing the conversation, but I guess I would be very careful about comparing corrections officers' positions to other types of employment.
Yeah.
I mean, you heard Steve Howard talk about the uniqueness and the stress of the job. And sometimes drug testing is about saving someone. Sometimes,
yeah.
let me just finish, please.
Yep.
The nature of the work, the power differential that employees have over people in custody is not comparable. In fact, I would submit to you in some ways that it's even more of a power and control balance than police officers have over individuals. They're in a confined space with people that supervise them, that possess all the power. And I'll repeat what I said earlier and what Steve said. The vast majority of the employees that work in the Department of Corrections are some of the finest human beings I've ever met, including the leadership of the Department of Corrections. And so I think all we're asking for when we worked with the committee is to study it more. We're not looking for a decision to implement a drug testing process or a polygraph process. We're asking to study it and figure out what the realities are, and then have that conversation about the kind of data you're talking about.
Yeah, I do see that. I still have concerns, and I'm not sure where the power differential affects the use of drugs. And people who work in the psychiatric hospital certainly have that same power differential. And I'm not sure if we shouldn't then study them also, and whether I'm just really concerned that we're we're focusing on one group of employees. And I know it's very different, but I don't understand the power differential and how that affects
Maybe another day
drugs.
we can have the conversation center about the amount of drugs we seize.
About the what?
Amount of drugs we seize inside facilities.
Huge.
And it's huge. We just had another major seizure inside facilities. And so the question for Jim Baker as the commissioner is, where's that coming from? Why do I need an investigative unit? That's one of the reasons why. Because then the suspicion's on everybody. And it raises the quality of profession. And I know you're getting short on time, so I just want to make that point as the commissioner.
Yeah, I get it. Oh, yeah. Senator Clarkson?
Yes, the DRM report is asking us to focus on this population. That's why we're focusing on this population. I mean, and so what I would like to ask Commissioner Baker while we have him is, I know, and we're thrilled that you're still with us. I have to say, Commissioner Baker, we didn't think you might still be with us last April when you kept insisting you were the interim, and yet happily here you are, because one of your objectives, as I recall, from January of 20, when I believe, when I think we first spoke with you, maybe it was earlier. Anyway, one of your objectives has been to shift the culture at corrections culture shift.
Mm-hmm.
And I would love to know if you put metrics in place so that you could actually measure your progress, and if you feel you've made progress, because that's also underlying all of this. It's underlying so much of what we're talking about here. To me, that is the biggest elephant in the room, and it's one of the many out there. Actually, the room's crowded with elephants.
Yeah.
But I'd love to know if you've made some progress and what those measures have been.
Yeah, and I'm not trying to cut this conversation off, but I do have another commitment that someone's
Oh,
waiting
sorry.
for. But let me just say this. We are beefing up our data collection on complaints, on things such as segregation of inmates in the system, use of force. We are beefing up those kind of data. But here's the biggest data, and this goes to Steve Howard's point. I appreciate, I must push back. When someone says to me as the commissioner that I don't care about the staffing of the facilities, nothing could be further from the truth. I want you to sit for a minute. I take this very seriously. We are doing exit interviews right now when people leave. We're getting a very clear picture of why people leave. And it's not because Jim Baker is the commissioner. It's because of the way they're being treated at the facilities. And so we are taking that head on right now. And so again, we are making progress. The good employees feel like they have a voice, which is the vast majority of the employees. And so do we have a long ways to go? Yeah. Am I here for the long haul? Probably not. But what we're trying to do, and I try to do this every day, is make sure that these employees, we've instituted a clinician program, peer support. We're trying to do our best we can to support them under a very trying situation. And we are making progress. We got a long ways to go. And again, it's getting off topic, but remember what we're asking to do is study polygraph, study drug testing. If the legislature decides that's not the way to go, or we find out it's too complicated, then so be it.
Thank you.
Madam Chair, I hate to do this, but somebody's waiting on another Teams call for me, and I do have to jump up. I think I heard that you may be taking this up again Friday.
Yes.
I will make myself available.
Thank you so much. Senator
Have a great day, folks.
Thank you, Commissioner. Senator Pauline, I see you had your hand up.
Yeah, just to talk about studying the drug testing and the polygraphs keeps me thinking more and more about the need to do a real analysis of the problems of the working conditions for the correctional officers and the kinds of issues that are leading towards the problems with retention and recruitment. I mean, if there's a drug problem, if there's a power problem, I mean, I think we need to really look at the problems at the working conditions and what the stress that's put on correctional officers when they go to work.
Yeah, I remember when we were talking about this before, hearing, and I don't remember if it was in here or in judiciary, that this guy was caught sleeping in his pickup, and he was asked why he was sleeping in his pickup, and he was sleeping in his pickup because he just gotten off a 12-hour, 16-hour shift, and he had to go back in 4 hours, so he didn't even have time to go home. So it is a huge issue. So Steve, I see you have your hand up.
Thank you, Madam Chair. I just wanted to just a couple of things. One is in my testimony, I just want to be clear. We're talking about the standard, and we're not saying that there should never be any drug testing. In fact, our members have testified to that. We're saying that the standard should be probable cause, consistent with other Vermonters, and that there is no need for random drug testing that would have a standard that would be less than what most Vermonters would experience and less than what the Vermont State Police would experience. Remember, Vermont State Police have a weapon. Our correctional officers do not have weapons. They cannot. They don't carry that kind of power with them. But I do also want to point to the Downs-Racklin report, which, remember, is a study of the Chittenden facility, and they said in the report that in 2018 to 2019, there was one CO who had, on 3 occasions, there was suspected alcohol use. There were, in that period from 2017, 4 reports of suspected drug use. And again, using the word suspected, the last line of the same paragraph where they state that, they say there was no disciplinary action related to these actions, and there was no physical evidence of drug use. And what our members testified in the House committee, and what they've told their union is, out of 400 people, can you guarantee that nobody there has a drug problem? No, you cannot. And certainly we want to get anybody who's suffering from substance use disorder the help they need. What they are saying is it is not as widespread as this report looking at the Chittenden facility would suggest throughout the whole system. And it's certainly not having as burning an effect on the whole correctional system as the staffing crisis. That is the #1 problem facing the Department of Corrections.
So I might be wrong here, but we talked about the amount of drugs that are found in the facilities. And first of all, I don't think the drug testing is only within the facilities. It would be for anybody working for corrections, I would assume, whether that's a probation officer or somebody else. But is there a difference between, if a CO is bringing drugs into the facility, that's an action for discipline and probably even firing. But is there a difference between bringing drugs in and drug use? You're not going to, by testing for drug use, you're not going to necessarily stop the contraband from coming in, because that's a different issue, isn't it? Or am I wrong?
I think they are
just because you use drugs doesn't mean you're bringing them in, and just
Correct.
Because you're bringing them in doesn't mean you're using them.
Yeah, I think, Madam Chair, you make a very good. Our members, and just this is anecdotal, so I don't have any scientific evidence of this, but contraband comes into facilities in many ways. I don't want to leave anybody with the impression that it's the staff that brings it in.
Right.
What you will hear from a lot of COs is that there needs to be beefed up scrutiny and beefed up security on visiting days. And then that's where a lot of the contraband problem comes.
Yep. Senator Clarkson?
Yeah, I actually think that this is why we need to read the Downs-Racklin report. And I'm trying to find it, and I can't find it on the House Corrections and Institutions website. It's not under other documents, and it's not under reports and resources. So I'm just curious where you could direct us to find it.
It's under Tristan Coffin's name. Let me just, I have it printed out.
Maybe
Gail,
we can have Gail put it on our website.
yeah, I think we all need to read this because I think we're just and talking. Yeah, I think we clearly drugs are an issue, and it was called out in the Downs-Racklin report, and we paid good money for this report. And I think we should listen to their recommendations. And this is studying this issue. It's not making a decision on it, but it clearly is calling out to be studied. So it's under Tristan. Okay, great.
Yep, and we should read it. I still do have concerns about the use of drugs as opposed to contraband, and jumping from the Chittenden facility to all of the other facilities. I think those are big leaps. But so, I know it's just a study, but we wouldn't study it if we didn't think it was an issue. If we didn't think that drug use among our corrections officers was a huge issue, we wouldn't study it.
Right, but it has been raised as a big issue in this report, and it is
In
one.
Chittenden.
So right. Right. That's right. But we could also, anyway.
Yeah. Well, I think we should read it and have a better understanding. So I do, are we dealing with the, Michael Chernick, are you here for the Montpelier Charter?
Correct. No, I am here for S-142, mom's opiate
overdose awareness.
Oh, great. Yes. Okay. Thank you. I didn't realize that you were the drafter of that.
Yes, I am.
Okay. Thank you. So committee, we're going to have this on again. And I would suggest that maybe we read the report from before then, if we can.
Madam Chair, would it make sense to have someone from DRM who wrote the report come in so we could ask them directly some questions?
And present it. That would be great.
We can see if they'll do it without charging.
Oh, okay. Yeah. Hopefully they would.
I'm not so sure. It's how they make their money and because it wouldn't be a lobbyist position.
Yeah, but we don't get charged by every lobbyist every time they come to our.
No. They wouldn't be doing it as a lobbyist. They would be doing it as the contractor who did the report.
Right.
But
and
we can see.
They would be invested in wanting to report it to the other committee of jurisdiction.
We can contact them. Sarah, who came in and testified to you?
We had several folks. We had Tristan McCoffin and his colleague. I have to get her name, but I could send that to your committee assistant if that's helpful.
Yep, that would be great.
Great.
Thank you.
I am posting that document right now.
Oh, thank you so much, Gail.
Okay, committee. Thank you. Thanks, Sarah.
Thank you, Steve.
Thanks, Steve. And we'll let you know the next time we have it on. And Damien, of course. And Amarin too, we'll let her know. Okay, committee, shall we jump here to S-142? And
jump. That's a good jump. A jump. Exercise. A brief moment after 2 hours and 15 minutes.
Can we take a 5-minute break?
Thank you. Sure. I have to come up with more creative ways to suggest it every time.
Actually, I did have it on my list to do.